Everyone, I would like to ask you to find your places so we can begin the meeting. Good evening, and welcome to the CCIH 2013 conference. My name is Paul Durstein, and it's my privilege to open this plenary. I'm serving right now as the president of the board of directors for CCIH, and so I wish to welcome each of you and so appreciate you coming to this event this evening and for the weekend. I'd like for us to begin with a word of prayer, if you would join me, please. Gracious Lord, we give you thanks for the safety of all those who have traveled from many distances to be here this weekend. We know we gather in an unusual way to look at not only issues related to global health, but to look at it from a particular perspective, and that is from our Christian faith. And so we invite you to be part of these meetings this weekend, open our minds and our hearts for new knowledge and new understanding as we seek to serve those who are all about us. We ask this in Jesus' name. Amen. This year, CCIH reached new innovative heights by making it possible for our brothers and sisters who are unable to join us in person to still participate in the conference. And so we're proud to introduce live streaming of all 6 plenary sessions. This morning, we kicked off the live stream launch by broadcasting both the family planning and gender health and development pre-conference workshops. Live streaming allows us to bring the expert voices of our plenary speakers to other global health advocates around the globe. For our live stream audience especially, it is imperative that we begin our sessions on time. And so as we try to move through these various sessions over the weekend, we ask that you work with our volunteers to help us stay on time with the programs. So we want to welcome all those who are joining us this evening via the live stream broadcast. Enjoy the programs. We hope to see each of you who are in places around the world this evening to be with us next year. And with those few words, I'd like to now introduce our Executive Secretary, Ray Martin, who will take charge of the program for this evening. Ray?
So here we go again. For me, I think it's about the 17th or 18th CCIH conference that I've attended. I may be outdone by Connie Gates and a couple other people, but Nancy, do you think you've done that many? But I'm glad you're all here. One of the unique realities of our conference is that it's a nice blend of first-class professional presentations and expression of our faith and our common Christian values. One of the things that CCIH does quite a bit of is attending conferences. So working for CCIH is not appropriate for people who dislike conferences. But an APHA conference or a Global Health Council conference, when there was a functioning Global Health Council, is a very good experience, but it's not the same as a CCIH conference. So it's good to be here, to be talking about serious global health issues, but to incorporate in our presentations, in our reflections, in our discussions, how our own faith, in our case, a Christian faith, because we are Christian Connections for International Health, how that figures into the way we see the world and the way we approach our mission of promoting global health and wholeness from a Christian perspective. So I'm tickled too to be broadcast all around the world. That's sort of thrilling. I don't know I don't know who's watching or from where, but when Jolene proposed this idea of live streaming our plenary sessions, I thought, wow, can CCIH do that? I thought that was for UN agencies and USAID and the Gates Foundation. But now the technology is advanced to the point, or maybe it's CCIH is advanced to the point, I'm not sure which, maybe both, that we can do this. I would like to particularly welcome people from overseas. We're delighted that a good number of people from Africa and other countries were able to make it here. We just wish that we had a little more influence over the various US consulates around the world so that everybody who wanted to come could have gotten a visa. That is one of the frustrating things that we have to deal with, and I know many other organizations have to deal with that problem too. So anyway, welcome to this conference. CCIH is not afraid to take on sensitive topics. For several years we've been working with family planning. Many of you are aware, at least somewhat, of the pioneering work that we've done in trying to position family planning in a manner that's acceptable and comfortable to faith-based organizations. This year we decided to take on the subject of gender and health and development. And I suspect most of you here are probably of somewhat similar mind on what the church should be thinking and doing about gender. I'm sure there are some differences, but we have to admit that when we look at the expression of church polity, church practice in communities around the world, including in many cases in our own in the United States and many other countries, the church is often the problem. But we would like to believe, and we think we have evidence, in fact, in the gender pre-conference this morning, we heard some of that evidence, that the church can be, and in many cases is, a part of the solution. And what we want to think about this weekend is how does our Christian faith impact on gender issues, and what leadership role can the church take, and how can people like us, how can organizations like CCIH and all of our members be agents of constructive change to make the church what I suspect most of us in this room believe Jesus considered as appropriate roles of men and women in community life and in the life of the church. So it's an exciting topic for us to be examining, and I invite all of you to participate vigorously in the various sessions over the next coming days, in which we're going to examine this question of gender and how our own theology, how our own church history, and how cultural practices impact on how gender relations are worked out in the life of the community and the church. And we're going to start this evening's program not so much with a focus on the church, but thinking about how gender figures in some of the work of the U.S. government. And so I have the honor, I think it's an honor, as a retired federal employee myself, to moderate the first panel in which we'll have 3 representatives of government agencies, and we're going to have a conversation about what their agencies do, what kind of programs they have, how they interface with issues of gender and development. And we hope that this will lead us to a better understanding of where the U.S. government is and maybe plant some ideas about how we in CCIH and our various members, how we in the faith community might partner with government agencies to advance our agenda for healthy gender relationships in our own churches and communities. So at this time, I would like to invite Kay Freeman, Daniela Ligiero, and Eric Williams to come to the podium. Welcome them, and I will introduce them. Green light, yes. Thank you. I think we can be most effective if I briefly introduce our three guests this evening, and then I'm going to ask each of them to speak briefly about their own agency and how their own agency addresses gender issues, and then we'll talk about how they interface with faith-based organizations, and we want to let a good bit of time at the end for Q&A. We would like to have some good interaction between our panelists and all of you. So, in no special order, Eric Williams. I think you can guess which one is Eric. With the names Daniela, Kay, and Eric, although I don't know, maybe some people from overseas aren't as good as in associating a particular given name with the male or female gender. So Eric Williams is a staff director of the House of Representatives. And I tried to memorize the full name of the committee and failed. So I'm going to read it. It's the House of Representatives Subcommittee on Africa. I can go that far. I'm familiar with that committee. But it's the Subcommittee on Africa, Global Health, Global Human Rights, and International Organizations. And he also works part-time with Representative Bass, a Democrat from California. So advocacy and communications are an important part of his professional history, including in the global health field. So he's, in fact, some of the organizations he's dealt with are organizations we interact with quite a bit. So he knows our professional community. He worked overseas in Europe and East Africa, raising awareness about global health worker shortage. Worked for the Gates Foundation, the Global Business Coalition, some of these quite prestigious organizations. Okay, I didn't know any of these people before tonight, so it's quite a privilege as a retired federal employee to get to know them. I used to work for the same agency that one of them works for, but I don't think we ever interacted. But to my immediate left is Daniela Ligiero. She's a senior advisor for gender at the Office of the U.S. Global AIDS Coordinator. That's what probably more familiar to most of you as PEPFAR, which is in our State Department. It includes many agencies, but the leadership is in the State Department. And she's the point person on gender issues in the PEPFAR program. and in that capacity is very interested and seeks to find ways to integrate AIDS issues with, with gender issues. Daniela has her PhD in counseling and community psychology, and she's done work in psychological counseling with survivors of gender-based violence. So she knows something of this, this topic that we are addressing this weekend at our conference. And Kay Freeman works for USAID, my old agency. She's a senior Foreign Service officer. I was a Foreign Service officer, but I wasn't a senior Foreign Service officer. I guess I left too early and worked for the World Bank instead. And she's the director of the office that's now called the Office of Gender Equality and Women's Empowerment, which I discovered on a phone conversation with her is the same thing that I used to know of as WID, Women in Development. USAID has had a concentrated effort to engage women in intentional ways in development activities going back to at least to the 1980s. And the 70s? Late 70s? Okay, in my time, the Percy Amendment was the big influential thing. And so we're delighted that Kay could come out here. She's a Foreign Service officer, as I was, working overseas, a mission director, or I think mission director, or acting mission director in Mexico, I believe, and worked in Egypt, Sri Lanka, Morocco, Mali, Cote d'Ivoire. So we want to start by asking the three of them to talk briefly about their agency and what their agencies are doing, what their policies are, what kind of programs they have relating to gender specific. It doesn't have to be just health, but with a considerable emphasis on how their gender issues relate to the health sector. So let's just start with you, Daniela.
Hello? Hello, yeah, okay. Thank you. Thank you so much for that introduction and for having me here today. It's a real pleasure to be here speaking with you today. I think most of you are probably familiar with PEPFAR, but just to maybe a little bit of background is helpful. PEPFAR is the President's Emergency Plan for AIDS Relief. And last month, it became 10 years old, which was a really big accomplishment. So there's a decade of PEPFAR now.
Happy birthday.
Happy birthday, PEPFAR. There you go. And, PEPFAR is the President's Emergency Plan for AIDS Relief. And as Ray was saying, it's headed out of the Office of the Global AIDS Coordinator at the Department of State where I sit. But there are actually 7 implementing agencies that really do the work in terms of implementing programs in the field. And those include USAID, CDC, the Department of Defense, HRSA. And so what my office tries to do is really help bring together all of those pieces and the different kinds of expertise within an HIV response, and to hopefully have it be better coordinated. That's why our name is the Coordinator's Office, which we try to do often and sometimes fail at, but most of the time get right, I think, because PEPFAR has had amazing results, and it's really an honor for me to be representing PEPFAR today. If you think about it, 10 years ago, there were about 35,000 people on treatment worldwide. And today, there are 7 million. And 5 million of those can be attributed in one way or another to PEPFAR's work. And that is a huge, I think, accomplishment worldwide that we have been able to be part of and really changing the tide of the epidemic. I mean, today we talk about an AIDS-free generation, which is something that 10 years ago was just a distant dream. And I say that because, the faith-based organizations really played a really important role and have continued to throughout those 10 years in terms of, helping first to care for those who were dying, then to, once the treatment became available to really help people get into treatment, to help people stay on treatment, to help with prevention. We were just talking recently about, just now, about orphans and vulnerable children and the amazing role that the faith community has played, in countries all across sub-Saharan Africa in terms of caring for those kids who are impacted by HIV. And so it's really exciting to see all of you here today and think about, are there other ways in which you could kind of help us and help the world move forward in terms of some of the global health goals? And it's really refreshing to have you focus on gender today, because that's my role, right? I mean, what I try to do is think about within this amazing thing that is PEPFAR, in all the countries we work in, across the globe, trying to do HIV prevention, treatment, and care, how can gender be integrated? And there are 5 key areas that we try to focus in on within our gender strategy. And I'm sorry, I didn't bring the handouts, but this is all available on our PEPFAR website, which is pepfar.gov. And the 5 areas are, first, equity in services, so ensuring equity in services for men and women. The second is working with men and boys on the constructive engagement of men and boys to change harmful norms and behaviors. And that's a really important piece. When we talk about gender, we also mean men and the role that men can play. The third is really preventing and responding to gender-based violence. The fourth has to do with issues of economic empowerment and education for women and girls. And the final one is around legal rights and how those really affect HIV outcomes. I want to just say a little bit about the GBV piece, the gender-based violence piece, because it is one where we've really scaled up our response. I'd say it's always been there from the beginning of PEPFAR, but over the last few years, we've really done a lot more to focus on that in coordination with the White House, USAID, and several others who are real leaders in this area, to think about how we can both prevent and respond to gender-based violence. And there is such an important role for the faith community there, because you all have helped kind of destigmatize HIV in a way that I think few other organizations are able to. When you have a religious leader that stands up and says, you shouldn't be discriminating because this person has HIV, or it's important to get tested, or those kinds of things, it has made a difference. And I think that unfortunately there's still a lot of silence around gender-based violence, whether it's intimate partner violence or sexual violence. And I think speaking out about it, making sure that communities know where to go when that's happening, and involving the religious and the faith-based communities at every level is really a key piece. We can learn from HIV and take that to the GBV world. And we've already started doing that within PEPFAR in a variety of countries. But I think that that's kind of like the next horizon in terms of learning from what we've done and taking it a step further. I'm going to stop there, Ray, because I know that you want to have plenty of time for questions. But that was just kind of an overview of the work we do.
Okay, thank you very much, Daniela. Kay, USAID has realized that half the sky is women, although we didn't use that phrase, I guess, until the book came out. But USAID has, I think, a fairly credible history on this issue. Can you share a little bit of that with us?
Sure. My office is fairly new in a way and also very old. Our agency has been, I would say, galvanized by the leadership of our deputy administrator, who truly believes that women and closing gaps between men and women is central to achieving development. He says, how can you achieve 100% of your development goals if you only are dealing with 50% of your population? Statistically, it makes sense. So AID had a gender policy, a women in development policy that came out, I believe, in 1982. And there was no update or rethinking of that until March of last year when we issued a new policy. And this is all going to sound really bureaucratic, so I apologize. I guess maybe backing up, does everybody know what USAID does? It's not a given, honestly. People go, what? Anyway, so what we've been trying to do in our agency recently is build on what we've managed to achieve by issuing a new policy and really kind of bring our personnel along, both in the field and in Washington, so that when they're looking at their programs, when they're designing the activities that they're going to be doing, they think about gender, they think about women, they think about gaps between women and men, boys and girls, and it's like second nature. In fact, they don't think about it, it's just there. We're not there yet. It's only been a year. Where we are as an agency right now is we're kind of building foundations. As many people probably know, we've hired, I don't know, 1,800? I don't know how many. We've doubled the size of the Foreign Service in the past 4 or 5 years. So that means we have a whole group of people who, unlike Ray and I, who probably remember the first policy, know nothing about this, at least not in the USAID context. And so we've had to do a ton of training. Last year, my office, and we're small, we're 9 people, we trained over 500 people. We have almost gotten to the point where we have an online training course that everybody in the agency is going to have to take within 2 years of joining AID, which is a basics on Gender 101, and it is really basic. It's like, what is gender? What's the difference between gender and sex? What is a gender gap? Things like that. And this has been I don't know if anybody else has ever developed an online course, but it's not nearly as easy as it sounds, as we have found out, and we're never doing it again. At least not in my tenure. I'm not doing that again. Anyway, so I think, the biggest thing for AID right now is we're trying to build capacity. We're trying to make this second nature. Interestingly enough, we are in partnership with Half the Sky. We have, yes, a partnership with Half the Sky, and I think it's Visa, I think.
Maybe some of the people probably don't know what happened.
Half the Sky was a book that was written by Nicholas Kristof, who is a New York Times journalist, and his wife, Cheryl Wu Dunn. And it's essentially a series of vignettes and stories about girls and education and what it means to them and how they can change their lives through education. They also made a series of short films that were put into a documentary that was shown on TV here, on public TV. They have a website where you can actually go look at some of these documentaries, and it's actually very inspirational. I make my daughters watch this stuff all the time, and they're like, Mom, really? But, for those of us who do have daughters, this stuff becomes very important. You want it too?
Yeah.
I'll see. I'll get you a seat. Yes. Yes. Anyway, so my office is essentially sort of the technical hub for our agency. We have people in the health field who work on the health aspects, people in education who are working on girls' education, and we try and bring everybody together. We're also, at this point, trying to blaze some new trails. We're trying to figure out, what is the impact, for example, of climate change on women? And how is that different from how it affects men? And what can we do about it? We're looking at economic growth activities, trade. If you have a trade policy negotiation, how do you make sure that whatever you are negotiating does not make women's lives worse? And so that's kind of where we are right now. I'm not a gender specialist. I was Foreign Service. I was a program officer for many years. And so we're trying to build up capacity. We want to be in a position where within a year or two we can finally see impact of what we're doing. And in the meantime, we have a bit of a stick. People have to do gender analysis for all their project documents now and their country strategies. And some people are coming kicking and screaming, honestly. But anyway, So that's kind of where we are.
Okay,
They kick, they scream, they're really not happy.
thank you, Kay. Do I remember writing project papers with the WID analysis, Women in Development analysis? So I'm glad. It's back. I'm glad that it is. That's great. But now I'm sort of wondering. Now having worked in the executive branch, I understand how PEPFAR and I understand how USAID can be proactively engaged in gender issues. But how can a congressional office called the Subcommittee on Africa, Global Health, Global Human Rights, and International Organizations engage with the issue of equity? Eric?
Well, I think the first part is about focus. You know, you read that long title of the subcommittee and you say Africa, global health, global human rights, international organizations. You're like, so where are you going to focus your time and your attention? And that is our biggest challenge, is to figure out how do we make sense of all the different priorities that are out there. And this is not only a challenge for the subcommittee, but it's a challenge for the full committee, and it's certainly a challenge for the entire Congress. As we all know so well, with the current economic environment that we find our nation in and that of other nations, it is difficult to find the resources needed to address any number of challenges and opportunities. PEPFAR is just an extraordinary program that has received immense funding over the last 10 years. I don't think that we will see something at the same scale and size of PEPFAR anytime in the near future, but it is our great hope that at some point we will make the commitments that we have in PEPFAR's case and in other areas, if not continuing the stories and the great success of this program over time. You know, I am not a gender expert by any means. Certainly, I've studied public health and have had a great opportunity to visit many nations in Africa, both prior to coming to the Hill, but also certainly with my boss, Karen Bassler from Los Angeles. And the stories that we see and the individuals that we meet within the U.S. government are just extraordinary stories about all of the great solutions that we've developed. Certainly in looking at HIV infection and being able to quantify and track HIV infection or TB or malaria. Certainly talking about gender-based violence. We have legislation on focused on the Democratic Republic of the Congo. One of the great tragedies of the DRC is around the violence exacted against women, and it is a story that goes untold to many, and is one that we have taken up and really tried to make a difference in terms of sharing the news, the terrible news about this. But in all, I would say, and this group is going to be doing an advocacy day coming up very soon, is what's needed most of all is education. We so often look at our political leaders thinking that they have the answers, and I am sorry to tell you if you believe this, but there are few answers that we have, and so it is about debate, it is about discussion, it is about bringing people to the Hill, to our offices, to educate staff who can then educate their bosses, members of Congress, whether it be on the House or the Senate side. And these challenges go as far as thinking about the makeup and demographics of the subcommittee or the full committee. So let me give you some information here. So there are approximately 40 or so members on the full committee of the House Foreign Affairs Committee. There are a total of approximately 5 women on this entire committee. Now this committee is responsible, they're authorizers, right? So we have appropriators on one side, people who are going to make decisions about how much money we're going to give to PEPFAR or the President's Malaria Initiative or any other initiative coming out of government. But then you have the authorizers, the people that are going to come up with the policies that then need to have a price tag attached to it. So if we're talking about gender and we're talking about equity and inequity, how is it that a committee of roughly 35 to 40 men are going to be able to make decisions about women's health, how we focus on and think about women, how we focus on thinking about girls, young people, So this is the type of challenge that we are faced with as we develop policy. And it's not a bad thing that we have men sitting on these committees, but it would be much better if we had greater gender equity and gender diversity on the committee. So on our side, the Democratic side, there are 4 women. So already we are starting to see the imbalance of the gender from one side to the other. And this is not a slight on any one party or another. We'd have to do a better job in both our parties to ensure that there are women that are there to develop the policies needed to address some of the world's most entrenched and enduring challenges. So, as I think about the work that I do in terms of being a Hill staffer and really a policy advisor recommending positions and statements for my boss, it is about thinking about these challenges. It's about talking with my colleagues who work in the executive branch at AID, at state, and other departments and agencies. It's certainly welcoming organizations like CCIH to the Hill to understand better, to host briefings so that you can educate members and staff, and opening our doors to everyone. We in our office have an open door policy. We basically don't say no to a meeting. And so it is a great opportunity to be able to invite organizations that have a position, understand those positions, do the research, and then develop policies that we think will make the difference.
Okay, thank you, Eric. Okay. Daniela, in your remarks, you mentioned a little bit about faith-based organizations and the role that they've played in PEPFAR. There's some interesting stories about the degree to which religious leaders and faith-based organizations influenced President Bush to make that initial big commitment that resulted in PEPFAR back in the State of the Union address of 2003. But I'd like another round with each of you to talk about maybe one example or 2 examples of how your agency has been engaging with faith-based organizations. Not just sort of the principle of it, but a specific example. And I think what would be very helpful for us too is that if you find complications in working with faith-based organizations, I guess this audience would like to think that we're pretty special, but we're adults here, and if there are aspects or examples where working with faith-based organizations has been problematic from your perspective, we should hear that. So, 1 or 2 examples and any problems that you run into in engaging with the faith community. Could you start, Daniela?
I'm happy to. Thanks. Okay, I'll try to speak very close so people can hear me. Sorry for those of you who are watching from far away. There's so much I could say to that. I'm going to focus in and talk a little bit about gender-based violence, which is what I was talking about earlier, because I think that that's a really good example of the kind of role that you can play. So we have started, as an example, doing surveys of violence against children. For the first time ever, national level surveys of violence against children to understand what's happened. And right now we've done them in Swaziland, Kenya, Haiti, see if I get this right, Tanzania, Kenya. And there are 5 to 10 other countries coming up soon. And in all of those we find that at a national level, about 1/3 of girls have experienced sexual violence. Not to speak of boys that also experience sexual violence at smaller numbers, about 10 to 18%, but still there. And other kinds of violence. But let's just focus on that for a minute. So, that means that just like in the US, these things are happening. And they're happening a lot. And they're happening in everyone's communities, not just in someone else's communities. And what we've been able to do with these data is go to political leaders and say, this is happening, what are you going to do about this? But another thing we've done is started working with faith-based organizations and saying, when the leader of a particular community, the religious leader of this community, is faced with these data, it's really hard to say, I'm just not going to do anything about it because of the values, because of saying, wait a minute, something's wrong here and we need to be doing something about it. And one of the things we've done is worked with the kinds of training we used to do for HIV, where you bring together religious leaders, sensitize them, talk about the issues, and then send them back into their communities and have an ongoing support system to see, can we do that around gender-based violence and sexual violence? And part of it, and I'll get to the issue of the challenges, is that when you work with these religious leaders, you're working with any other human being. They've learned certain things about gender, about the role of men and women, not only through their faith, but just through their upbringing and community. And so part of it is to have them stop and evaluate that. What are my beliefs? What do I do in my home? What did I grow up with in my country? And so it's really refreshing to hear your first, Ray, talk about the importance of doing that, because I think it's important for the faith-based community. It's important for every community. We all have biases. We all grow up thinking certain things. And in a lot of the countries we work in, violence against women and girls, for example, is considered appropriate or is considered just part of the way things are supposed to be. And so to really stop and rethink that takes a lot of self-reflection. And I think that you are in a position where you're able to help communities do that in a way that maybe they haven't before. But it also means doing it about yourselves. And so I see that as a challenge, but also a great opportunity. And I think using those models that have happened for HIV is one way to do that for gender-based violence, and to break the silence. I mean, the silence is one of the most difficult things to deal with. And I say this as someone that's worked on this issue for over 20 years, but also as a survivor of sexual violence myself. I know how difficult it is to speak about this, to tell the story. And I think more and more people need to come out and start speaking about, the experiences that they've lived, as well as what they've seen in their communities and families. And it creates this movement where you say, you know what? We can make this different. And I know that everyone in this room is here, to do good. And, this is one of those areas where I feel like you're very much needed. So.
Let me share a bit of a presentation that was made in our morning pre-conference on gender, health, and development. Pam Carey, is Pam here? Yes, I should. I'll try to say a few things. I should ask you to come up, but Pam is a graduate student, doctoral student at Loma Linda University in California, and that's an Adventist school in the School of Public Health there. It's an Adventist school of public health, you may know it. She said that one particular conference of the Adventist Church in the United States did a survey in their territory and found that 34%, this is in the United States, northern United States, 34% of women reported violence. I don't know whether it's all sexual violence, but it was violence. And 20% of males did also. So this idea that I think sometimes some of us in the rich world in the United States may think that gender-based violence is something you worry about in India or Africa or somewhere else. No, it is definitely not limited in geographic scope like that. And to add to this, this survey was people in the church. It wasn't the general population. It was people in the church. And I was really rather surprised, not completely surprised, but a little bit surprised of that. But do you have, Daniela, let me probe a little bit more, because Pam in her presentation was talking about how they then did work in different countries. This was not in this particular area, but how they were working in other countries. And there was a World Vision video shown too, about how programs used the Bible to address this issue, to change what were essentially cultural values that, that affected gender-based violence issues. The acceptance, not only the perpetration of violence, but the acceptance of violence in many cases by the victims. Do you have any, I don't know whether these surveys probably didn't disaggregate by religion or anything like that, or do you know whether they did? But I'm just sort of probing for how can we as faith-based organizations, in many cases actually working with local churches and congregations, how can we be more intentional about addressing these underlying factors that lead to this high prevalence of violence?
That's a big question. I'm going to try to get to it, but I think it's a really important one. I think that, and Kay can speak to this too. I think when you talk about gender-based violence, at the root of that you're really talking about inequality. And so when you have, for example, children in an unequal level with adults, they're able to, and then we have this whole field of violence against children. I mean, a lot of the basis for that has to do with this inequality. There are a lot of other factors as well. But when you talk about violence against women and girls, that's also a big factor. And so, if culturally, I was just in Mozambique, where we have a lot of programs going on, and I visited this particular community, and they were talking about how I was talking to the women, they were saying, well, if my husband doesn't beat me, it means he doesn't love me. And so, to change that really means rethinking that. What is that about? Like, why? Where is that coming from? And in other places, I've talked to women that say, my husband beats me and rapes me, and there's nothing I can do because I have no work, and if I leave, I'm going to be ostracized by my community because I've left my marriage, and I'm going to starve to death. So I need to stay in this relationship, and there's nothing I can do about it. So there are lots of examples like that of situations where part of the reason for the violence has to do with inequality, but then resolving that also has to do with addressing not only cultural norms, but the whole issue of economic empowerment. So I think part of it is the dialogue. I really liked what you said, Eric, about bringing people together, starting to think about this question that, so in your case, is that really a Christian value that we want to be, continuing within this community? That to beat your wife means, that you love her.
Can I chime in here as well? I was referenced the DRC, and it takes up a lot of my time and my boss's time thinking about the complexity of the challenges there. And it's certainly about inequality, and it's also about the tearing apart of society, fabric of society. We've got a country that is larger than Western Europe, right? It is a country that spans the center of Africa, that is bordered by 9 countries. And within it, you have some of the highest rates of rape in the world. And you ask yourself, how can this be that a country that has immense wealth underneath its soil and immense wealth above the soil, whether it be arable land for agriculture or hydroelectric power generation, how can this country be so tattered? And you ask yourself leadership. You ask yourself, is there a security sector there that is capable of protecting women and girls and boys and preventing there being child soldiers? And the answer, as it comes back to us, is no. There is a leadership vacuum that needs to be addressed. There is a security vacuum that needs to be addressed. We have UN peacekeepers that have been there. One of the longest UN peacekeeping missions in the world happens to be in the DRC, and we've given it an expanded mandate to go after armed militias that are pillaging communities and raping and taking kids and putting them into armed groups. So when we think about how do we address these issues, inequality is certainly there, but certainly also looking at the leadership, the strength of the leadership, and its ability to marshal a plan to address these challenges.
Thank you for that, Eric. I would be interested in, with you, Kay, because I think I sort of understand where you come from, because I worked in your environment for 25 years, actually. Can you give us a couple examples of, sort of major examples of how USAID did concrete things to address women in development, or now women's empowerment kinds of issues? And you mentioned that project papers require an analysis. It used to be the WID analysis. I don't know what you call it. What do you, gender analysis. Can you say a bit about what you look for in a gender analysis when a mission proposes a new project? What do you insist that they look at? And then, of course, if you have specific examples of how USAID partnered with faith-based organizations in this arena, it would be interesting for us to have an example or two like that.
Actually, just to follow up on the gender-based violence discussion we just had, my office last year kicked off a research program. We're looking at sort of the social breakdown that happens on what we call the relief to development continuum, and where the windows are when GBV goes up, and what systems can be put in place to keep it down. I was recently in Cairo, and one of the major topics of conversation, Cairo was always like the safest place on the planet. And now women can't walk down the street. And it's all over the TV, and everybody's upset, but no one's doing anything about it. And it gets back to your security vacuum, because I'm not sure how many people saw this, but there was a video from about 18 months ago where there was a young woman who was wearing a blue bra. Now, for a young woman in Egypt to actually show her bra was just like, and she was being dragged across the street by security forces. And so I think, when you look at GBV and you look at how it's impacting girls and you look at social breakdown, there has to be, we're hoping we can garner some lessons from all of this and maybe turn that into some practical tools. Because aid works a lot in humanitarian situations, and we all know that GBV is a big problem. Anyway, so that's my 2 cents worth on that. Now, USAID actually has an Office of Faith-Based and Community Initiatives, and I believe the director of that office is going to come talk to people. Is that tomorrow?
Tomorrow morning at breakfast, whoever comes to listen.
Whoever wakes up. Yeah. And so, that's a fairly new initiative at AID. I think it was actually under the previous administration, surprisingly, or maybe not. Anyway, so who knows? USAID obviously has worked with faith-based organizations consistently throughout our history. It's, we've worked with World Vision, we've worked for Bread for the World, we've worked with Lutheran World Development, and we have had relationships with faith-based organizations over the long term. I would say the major sort of impetus at the moment is working through implementing organizations, whether they be faith-based or not, and making sure that whatever these organizations are doing fits with our country development strategies, what we think the priorities are, and bringing all resources, all expertise to bear on these particular problems. I do think in situations related to gender-based violence or gender in general, quite often faith-based organizations actually have an advantage. If you're looking at changing social norms, changing what's acceptable, I think religious leaders, community leaders have a huge role to play in that. And it can't just be teachers. It has to be kind of the whole community. And so I think faith-based organizations if only looking through that particular lens, have an enormous role to play. I actually did come with an example of one that our office has done. We've been working with Samaritan's Purse in Liberia.
One of our members.
And the project actually has a very cool acronym. It's INAWE, I-N-A-W-E, Integrated Agriculture for Women's Empowerment. Now, I realize this is not a health program, but it, I think, demonstrates some of the advantages that we find when we work with faith-based organizations. In this case, Samaritan's Purse has worked in this particular area for a very long time, and they know the community leaders, and they understand the dynamics of what's going on. And so I think what they've been trying to do is improve food security for, I think it's 25 communities. And it's in a fairly remote part of Liberia. Somebody from our office went there last year, and they had to go in a helicopter, which I think she thought was kind of exciting. I don't do helicopters. But anyway, I mean, it's looking at how do you empower, in this case, women to be actors in improving food security for the whole community. And so they talked about looking at the various parts of the agricultural system that women were particularly involved in. And they've helped them in terms of raising vegetables, improving fruit tree production. They actually had a pig project, ducks, fish ponds, and giving women training in, ag extension techniques. How do you market your products? How do you get your products to market? And how do you actually go out there and sell something? How do you sell a pig? I wouldn't have a clue how to sell a pig, but if I was sitting in fairly remote districts in Liberia, I think I would really learn a lot and gain a lot from training like that. I do think, on the women's empowerment thing, economic empowerment, there's, a number of cautionary tales, including, Grameen Bank, which is very famous. And that's another thing, actually, that we're looking at in our research agenda, is to what extent does women's economic empowerment help women? Or are there instances, for example, where women are increasingly economically self-sufficient, that it increases gender-based violence? So.
Okay, thank you, Kay. Eric, on the legislative front, I'd be interested in hearing from you on a couple things. One, do you have any specific examples how we were able to use legislation to address gender issues? Kay referred to the Percy Amendment. That certainly for USAID, that was the big thing going way, way back. And Percy was a senator. Are there recent legislative actions that have impacted on how the United States government addresses gender issues in global development, global health specifically, or global health generally? Why don't you address that, and then I want to ask you another question.
Why don't you give me your follow-up as well?
Okay. The follow-up is, we're Christian organizations, faith-based organizations. CCIH is a network of many organizations that are represented here. What do you observe as the impact that the voice of faith-based organizations might have in the halls of Congress? Do we matter to you?
Yes. You won't boo me out of here. So I don't think I'm qualified to answer the first question, just because our current setup for legislation doesn't include any pieces of legislation that are currently moving through the pipeline that are that are focusing specifically on women or gender. But perhaps my colleagues can talk a little bit about some things that are currently right.
Yeah, in 5 minutes or so, I want to open it up to the audience.
Sure. So to answer the second question, which I'm very qualified to answer, yes, your presence is needed, much needed on the Hill. I think that there is a chilling effect, if I can say, with a certain position from the faith-based community coming from our subcommittee and coming, I believe, from more or less from the majority party that's currently in the House. We are constrained in talking about the full range of family planning topics and solutions to women across the world. And it is a real challenge for our office to bring to the committee a hearing, for instance, that talks about the full range and complement of these issues because of fear around abortion. And so we need to hear from the faith-based community that is interested in having a discussion. There is nothing wrong with having a discussion, yet what we find is that oftentimes discussions lead to nightmare situations where we're vilified and we're not able to fully engage with a broad community that has diverse opinions and positions about how we look at and think about women and what are the solutions that can be done in a policy framework. So again, your advocacy day on Monday will be very important to not only talk to Democrats but Republicans about the fact that you exist and that you are many and that your vote counts and that your voice counts and that the voices of millions, if not billions of women need to be heard equally with those that feel slightly differently about how we think about women in health.
Okay, and Daniela and Kate, do you want to say something about my first question? And then we'll open it up to the audience. So form your questions in your mind because you'll soon be on camera, or can be on camera. So Kay?
Yeah, I was actually just going to talk about congressional requirements that have impacted my life over the past year. And you know, if you work for aid, you have to do this stuff. It's part of the job, and quite often I have seen cases where earmarks that we've just bitched and moaned about actually turn out to be really quite good. And I you know, it's embarrassing to admit that, but sometimes other people know better.
Well,
you know?
have no more earmarks anymore, so maybe we need to bring this back.
Yeah. Oh gosh. Anyway, so a couple of things that have influenced my work over the past year. We have, as part of the appropriation bill, we have what's called the Women's Leadership Directive, which has been running about $20 million a year. And what that is and the language around that is very broad. It's just activities to improve the leadership skills of women and girls. Could be a lot of things. And so we've been programming against that, certainly in the time that I've been in this job. In FY12 appropriation in the Statement of Managers, we had a requirement to produce a joint strategy with the Department of State on gender-based violence. And that's how come we know each other. Actually, we looked at that and we realized that, you know, while aid and state were major actors, we weren't the only ones. And so we actually persuaded people at the national security staff to act as conveners, and so we brought the whole range of US government agencies who work on gender-based violence together, and we produced a joint US government strategy, which was painful, but I think it's a really good document, and I think will be very helpful. And the final thing that has certainly made a stir for us this year is we were asked to produce a strategy on combating child marriage. And we actually issued it in October on the International Day of the Girl. And it's something we're quite pleased with, and I think will guide our programming for a long time to come. And so, this is sort of some real concrete examples of the kind of things that we have done because congressional intervention has said we should do them.
So Daniela, do you have something to
Yeah, I'll
add?
just be
And then
brief.
we'll open it
No,
up.
and I'll just say that, for PEPFAR, that was key. I mean, in 2000, when it was first authorized, there was language in there around the importance of gender. But in 2008, when it was reauthorized, that language got significantly stronger and called for a series of things. And I'm actually the first full-time senior gender advisor that this office has had, in part because of that. So it makes a big difference.
And don't forget that when Secretary Clinton was at State Department, an office was created to focus specifically on women. The first U.S. at-large ambassador on women, Melanie Verveer. So we have made leaps and bounds progress, whether it be through legislation or administrative action through the White House to spend a greater focus on women.
Some of us are meeting with that office on Tuesday at the State Department. So, given that we're live streaming this session, how do we handle this with Q&A? Do people have to come up front, or who's our expert?
Want me to run? I can run out there.
Question.
Please introduce yourself.
I'm Nancy Harris from GSI, and I'm a board member of CCIH. I wanted to address something related to gender-based violence. Both Kay and Eric talked about fragile states and the need to rebuild societies. And some of the evidence suggests that gender-based violence is best dealt with community-based organizations and including faith-based organizations. So how do we balance the need to do supply-side programs that provide ARVs and build governments, build health systems, build education systems with funding that gets down to the really grassroots? And sometimes that's incredibly little funding that can do a lot, but it seems terribly, terribly scarce these days.
That sounds like a good question for you, Kay. And maybe Daniela also.
It was interesting when you were talking, I was thinking, in some respects, we've been having a reverse issue, which is when you're looking at gender-based violence and you're looking at issues like child marriage, so many of the activities that are really successful are very, very small community-based activities. And it works because whoever the community leaders are, whether they're faith-based or not, are there and they can finger people, And so our issue lately has been looking at these very successful but very micro-level activities and figuring out how do you take those to scale? How do you make that nationwide? And that's another part of our research agenda that's ongoing, and hopefully we'll have an answer in a couple of months. That would be great. I understand a little bit what you're saying about the funding streams, and I kind of feel like I'm punting a little bit, but with sequestration, honestly, we're trying to be as creative as we can. It's going to be a tough budget environment, certainly for the next couple of years. For AID, right now, we do not have our FY13 money. And that's, 3 months before the end of the fiscal year? So, systems aren't working quite in the most efficient way right now. And so it's not just small and micro activities, community-based activities, it's affecting everything.
Then, Daniela, I remember some of the figures that PEPFAR would publish about percentage of grantees that were faith-based, I think it was in the 20s somewhere, it was a lot. But how do, I'm not sure who all they were. Some of them were very big grants to some of the very large faith-based organizations, the Catholic Relief Services of the world. But what about Nancy's question about a big government agency that doesn't have the capacity to administer hundreds or thousands of small grants? But how do you then deal with this seeming reality that often what works best is what happens at the community level on a small scale?
That is a big challenge, absolutely. And I think one that we have continuously tried to think about creatively. But you know, one of the challenges that we have, well, in addition to sequestration and everything, that's a big challenge. If all of that were taken care of, there are a couple of challenges. The first is that more and more we are called upon, because of the tight financial environment, to show results that are connected to the funds that go out. And so that means certain kinds of monitoring and evaluation that need to be in place to be able to say, okay, there's not a lot of money, you got $5 billion, you better have done something really good with it. And so one of the challenges is that a lot of these small-based, community-based organizations, whether they be faith-based or not, don't have the capacity and the infrastructure to receive the money and also to be able to monitor in the way that we're requiring folks to. So it's a bit of a conundrum for us because, you know, we're getting, you know, from Congress and the taxpayers, you know, this, like, we want to know. And on the other hand, you know, we also know that, you know, you can't necessarily give a $50,000 grant and expect this small organization to fill out, you know, that indicator sheet that we have for you that goes up the system. So that's one challenge. But I think one of the things we've tried to do, as you say, we've always worked a lot with faith-based communities, and we continue to. So, for example, last year we worked with the Office of Global Women's Issues, with GWI, we like to call them GWI, and had a small grants program that was specifically for HIV and GBV, and it was up to $100,000. And we got out, you know, it was $5 million in grants, and we're thinking about doing a second round. But it really gave the ability for these very small community-based organizations to get some of the money. Several of the ones that got funds were faith-based organizations. And there weren't a lot of requirements around reporting and all this because there were small grants. But you know, it took work, and you have to be creative sometimes to be able to have funds that can go to something like this. I will say one strategy is when at the country level, you know, there are examples of countries where a variety, like in Tanzania, a variety of faith-based groups come together and together reach out and try to get funding. That seems to work well also and is a creative way, so it's not your small organization that works with 200 people in this district, but you know, if you put enough of those together, it's easier to show impact, it's easier to hire one person that can do M&E for everyone, monitoring and evaluation for everyone. And in Tanzania, for example, it was happening across faiths as well. So you would have, you know, Muslims working with Christians, really coming together and saying, as a faith community, here are the things that we think we can do in our communities, and trying to access resources that way. So that would be one recommendation I would have for you to think creatively about doing that at a country level.
Yeah, that's a good challenge for us. We should try to do more of that.
And I think the opportunity here on the legislative side is to share stories like this with member offices. That if there are great case scenarios where they've done just extraordinarily well, that we might be able to figure out a way of working this language into some legislation. Finding a little bit of resources to pilot a program that brings faith-based organizations together and pilots it, let's say in Liberia, whereas it was in Zambia, or in Mozambique, whereas it was in Angola. But there are opportunities for us to look for ways to take these really great ideas that work really, really well and try to put them into law and make sure that there aren't great reporting requirements so that you can do your job. And because I know that that's a big challenge.
Oh, Kay, I'm hearing, I'm letting this go on because this is a very important conversation for us, because we're always struggling with limitations of what we can do with our own resources, which is why we're often, and many of our members are looking to government agencies, international institutions to enter into partnerships so that we can expand our capacity to do what we think we can do. So, Kay.
I was just going to make one more point, and I don't know if people know, but our administrator launched a couple of years ago an initiative called USAID Forward, which is reforming USAID. And one of the very important aspects of USAID Forward is what's called in shorthand now local solutions, which is encouraging our missions in the field to work directly with small organizations in country, with local organizations, build their capacity if necessary, but work with them on the ground to implement programs in a way that we can have some success that we can report on, but then also build capacity where we're working.
Great, okay. Thank you, Nancy, for generating that. Back there, I can't, with the lights, I can't see very well, but stand up.
I'll just speak into the mic. Yeah, David Barstow from Impact Africa. This is a question for Daniela. You, when you talked about the role that faith-based groups have played in the stigma associated with HIV, you spoke in the past tense. And the sense that I have, the work we do in Southern Africa, is that there are an awful lot of churches that have an awful long way to go before we could really call them free of stigma. I guess I hope I'm wrong, but I was wondering about your sense.
Yes and yes. And I'm sorry if I said it that way. I didn't intend to. Absolutely. I think there was from the beginning, I think what I was referring to was that PEPFAR was a little unique in some ways. I think because from the very beginning, the faith community played such an important role, but it absolutely continues to. And I think what I was trying to say, and I'm sorry if thank you for the question because I obviously didn't make it clear, is that one of the things we're now exploring is, given that very strong role that still exists and is still so important, are there other things that we could have these communities work on that will also have an impact not only on HIV outcomes, but on health outcomes at large? And because we already have that platform of these connections and communities that are, that are receiving resources and trainings that we've done, and a lot of the systems are in place. And it's so how do you get that system that exists and is still going on and say, is there a particular topic like GBV that we can now add on to that conversation? And those are the kinds of exploratory conversations we've had and that we're moving forward on in terms of adding GBV to the existing work.
Other questions? Other questions? We still have, okay, Joy?
My remark.
Please introduce yourself.
My name is Joy Mukaire. I work with the Christian Health Association of Sudan, South Sudan. And my remark or question has kind of been preempted by the most recent remark regarding the funding mechanism, particularly for USAID, and how if we organized ourselves as a network or as one group, how we, actually it was a comment from the PEPFAR experience, how we can access the funding to do the little things we can do, but do them well. It has worked in South Sudan using another grant, the Multi-Donor Trust Fund for HIV/AIDS. We were a network and we were able to take care of 2 states. And we had great outcomes from that. But with the USAID funding mechanism, unless if the RFA specifies that the prime would take care of that kind of arrangement, it will always, the funding will always go to a consortium, it will always go to the prime and a few subcontractors, and this will still not make it possible for the faith-based groups to access that kind of funding. There are countries where, in the areas of contracts, where a contract would have something like when you bid, you are bidding, but TASO is part of what you are bidding for. Knowing that TASO has a great role in that country at that time, in the area of HIV/AIDS, TASO was part of the bid. If you are bidding for this project, TASO as a national organization which is doing tremendous work is part of what you are bidding for, to provide the capacity it needs for it to do the good job and to scale up. So some of these RFAs really need to take care of that, to know that if faith-based networks are so crucial in some of the countries and are making a huge contribution, if they are part of what anybody is bidding for, then there is assurance that they will at least access the funding to do what they do best.
Any reactions? Thank you, Joy, for that. Thank you.
Can I ask a question? You
Introduce yourself,
my name
Pam.
is Pamela Makairi, and I'm a student at Loma Linda University. But I just wanted to know if there was one thing that you would say a pastor could do in response to gender-based violence that's beyond prayer, what would you have them do? Because we've spoken about what we think they should do, but half the time the surveys show that the women do want pastoral care or some involvement, but it's hard to describe exactly what we see their role as. So what would you say that if you had to give a little job description, maybe of 3 things that a lay person would do, what would that be?
3 things. Okay, I feel there's a lot that can be done, but I'll just talk about 3. I think the first one is what I was talking about, helping people question their own attitudes, norms, and behaviors. So, telling a story, and if you're talking about your group in particular, from the Christian value, like about, men and women and what are their roles, and starting to question, like, okay, and, is it okay to beat your wife? Is it not? If someone doesn't want sex and you're forcing sex upon them. I mean, that kind of, just starting to have some of that dialogue, I think is one thing that is very useful. I think the second one is a little bit of what you were talking, condemn it. If if someone in the community has raped someone else or is beating their wife or something, for the pastor, that is such an important, shaming intervention that works to say, it is not okay for you to do that, and to intervene and say, this is not okay, I think would be another thing. And then the final one would be, I think, to help direct people to the resources that are there. So a lot of times people come and they say, this has happened to me, I don't know what to do. And if the pastor says, let's just pray, that's one, intervention. But to also say, in addition to that, there's a center that's 3 miles down that works with survivors of sexual violence. You should go there. So to even understand what those resources are and direct people to the resources that sometimes are happening and are part of the community, but people don't necessarily know about. So I think as that go-to person, the pastor can really play an important role as well. So those are just 3.
Can I add? Please do. The other thing is that our pastors don't necessarily know all the answers, right? I mean, they need to be technically, their capacity needs to be built. And so it is important for them to also find opportunities to learn more about the issues that they are going to be facing with their congregation. Most pastors are going to be men, so do they really understand their female congregation? Maybe the mother of the church is equally important to be involved in this conversation with certain populations that might come to the pastor looking for assistance.
Okay, one last question, Jean.
Jean Sack. I'm currently working with Chapaigo. Yesterday we saw in New York Times there was a report from Kenya, Mara, I think, that a judge finally ruled that raping little girls in order to get rid of your sexually transmitted diseases was not permissible. They said the society was guilty of promulgating sexual violence against little girls. And this has happened in Botswana and other places in South Africa. And this myth is puzzling. Why has it gone on for at least 35 years? So legal means needs to be used. Journalism can be used. You mentioned Nicholas Kristof and his wife. What else can be done to change these kind of myths of cultural violence?
I'll take a shot. I think getting back to what you were saying about the role of pastors and what they can do beyond just praying with people, that they can have a very sort of hands-on role is important. USAID, we do lots of surveys, we gather all kinds of data. And I think for me, the last year, one of the most shocking things was DHS data, Demographic and Health Survey, that showed in many African countries, it was something like 85% of men thought it was fine to beat their wives if they burned dinner. And something like 75% of the wives thought it was okay if they burned dinner. And I think, if you're looking at how we get past that and how do we make that not okay, the legal system certainly has a role to play. But I think when you're talking at a community level, unless you have a security sector that's functioning, and functioning at all levels, not just, in capital city or whatever, that's never going to happen. And so I think if you can use the schools and churches or mosques to mobilize people to change the attitude that it's okay to beat your wife. I remember years and years ago, I don't know if anybody else remembers this, but I think this was back in the 80s, and this was in DC. And the wife of the person who was the chairman of the SEC showed up in the police station because she'd been beaten. Her husband had beaten her, and he was the head of the SEC. And that was just an incredible, game-changing event. I mean, I'm sure the poor woman was not thinking about that when it happened, but the idea that somebody who's the head of the SEC could do this, and it wasn't okay for him, and it's not okay for, the guy in the village who beats his wife because she burns dinner. I think it's kind of you have to shift how people think. And I think churches, mosques, religious leaders, community leaders have an enormously vital role to play in that, because people listen to them. And it's not because they're going to beat them up or whatever. I mean, they have positions of leadership in these communities. They have positions of influence. And they need to be mobilized to work on changing some of these norms. I always feel like a cultural imperialist when I say things like that. But, it's not okay to beat your wife. It's not okay to rape your children. And there's, religious leaders, community leaders have an incredible influence in deciding what is okay in a community. And I think that's an important thing that we just have to keep in mind all the time. And if we have to have training courses that reach these community leaders, that reach the religious leaders and say, this is your role, here are some suggestions on how you can actually do that. I think it would be an incredibly important piece of work.
Very useful. So this is your last word, Daniela?
Are you wrapping up?
Yeah.
A minute? Okay.
And Eric, give you a last word.
So I just want to build, I think this is such an important discussion. I just want to build on what you just said, because it's so critical. And, one of the pieces of our gender strategies, going back to the beginning, was engaging men and boys. And I think that is so critical. Men have a very important role to play. And we have, just to give you an example, we have this project that in several African countries within gender health called Men as Champions. And it really talks about, and a lot of times they work with the religious leaders in the community. Who are the men in the community who could be the champions for this, who can speak out about this, who can, say, I don't beat my wife, and I'm still a real man, and I don't need to force sex on someone, and I'm still a real man. What does it mean to be a real man, a good father, a good husband, and to speak out about that? And I think that, the religious leaders also have that role, and we know that that changes the way people think and communities. And so this isn't, a lot of times when we talk about gender violence, gender-based, very quickly we get into men against women and women against men. And it's everyone working together as a community, and everyone has a role to play. to change those norms. And finally, I travel all across the world looking at these programs, and I can't tell you how many times I hear, but that's just cultural. It's the way we are. Nothing you do is going to change that. It's been like that for years. And that is not true. We know of many places where norms have been changed. It takes a long time. It takes a lot of work. It takes everyone to get engaged. But it is possible to change those norms. And so I think part of it is just being able to give people that hope that that is possible and that they can work towards that goal.
Very helpful. Eric, your last word?
I think I should not say anything. I think that was just a great summary. The thoughts that I would have is that as you continue on these next couple of days and as you make your way to Capitol Hill, see it as an opportunity to take the evidence from what you have acquired over the next couple of days and the work that you're doing already in country, or for those of you who are based here in the States that you have from your other colleagues, and tell us what you think, and share with us your ideas and your opinions. And it's so often that we don't hear about the evidence. That so often we hear about the ideology, but we don't have the evidence to support the policy. And if you're able to bring your experiences and share that information, there are people here from Africa and from other parts of the world. Share your stories with us, and we will be able to hear something that we haven't heard before, and that will help us thinking about how we formulate good, sound policy. Now, we've got a lot of homework to do in terms of cleaning up the sequester and making sure that the resources are there so that we can do good programming. But it's certainly much better to have the evidence and the success stories to help us think about ways to focus on women, focus on gender, focus on ensuring that all of the work that we're doing isn't for naught. Because if we don't continue the commitment of PEPFAR, as an example, we will move backwards. And we will have wasted U.S. taxpayer dollars. So how do we do it in a way that leverages the future for a positive gain? Thank you very much.
Great, thank you. Well, you've all actually, I think, given us some homework. Thank you for that. And this has been a very rich discussion. Let's give our panel our thank you. So ends panel one. Are there any announcements?
Yes. Hi, thanks, Ray. So thank you to our panel once again. I'd like to ask a quick question for the education of our panel. How many of you in the room have received PEPFAR funding before and have worked with PEPFAR funding? What about USAID funding? Okay, and how many of you are going on Advocacy Day or now want to go on Advocacy Day because of listening to Eric? Very good. Yay, woohoo! It'll be a good time, so thank you for that. I'm Mona, I'm the project manager for policy and advocacy at CCIH, and I'm excited you are all here. I know for some of you it is the middle of the night and you are exhausted, so I'm proud of you for making it through. I just wanted a few announcements. There are some snacks out in the exhibit hall. Some ladies from my church made some baked goodies for you all, so that was lovely, and then some of the staff brought some other snacks. So please have time for fellowship, and we have a concert tonight here starting in just a few minutes. High Street Hymns has come from Richmond, Virginia, which is about 2.5 hours away, and we've invited local churches to come and be with us and learn about what CCIH is and who we are, and to meet people that work in global health as a way of trying to educate people here in the Arlington, Virginia community that there are Christians that care about international health, so you might meet people that are here from other churches that are local, and I hope you welcome them to our community and have great conversations with them. Tomorrow morning on page 29 of your booklet, sorry, is this really loud? I apologize, is we're supposed to go on a community walk at 6:45 a.m. with me. Who doesn't want to join me? Last year's conference, it was said we ate too much and didn't exercise enough for a health conference, so I listened to the evaluations and I planned a walk. However, with the rain, that might be a problem. So if you wake up tomorrow and it's raining, I won't be walking. But Sunday morning is another day, and so we just might move the walk to Sunday, which is 99.9% what will happen. So sleep in tomorrow, early morning Sunday walk. We'll pray as we walk through the neighborhood. There's a beautiful trail that goes through a wooded area, so it will be really great. And then what else? Breakfast is at 8 a.m. tomorrow morning. As Kay said, Mark Brinkmuller from the USAID Office of Faith-Based and Community Initiatives will be at breakfast, and there will be a table marked USAID. So we really encourage you to go sit with him and to talk to him about more of what USAID is doing. And our opening session starts here promptly at 8:50 with worship led by Joel Weathers, one of our board members. And so we really encourage you to be here then. And I hope I'm not forgetting something. Oh, how many of you are staying off-site and need to take the metro? Anyone? Okay, the Orange Line is having construction this weekend, so please plan for extra time. I think that might be it. Please go meet people and sleep well. Thank you.